According to the CDC, in 2011, 8.7 million people were infected with tuberculosis, and of those, 1.4 million died. It is second only to AIDS as the greatest killer worldwide due to a single infectious agent. It is the third leading cause of death among women ages 15 to 44. What if I told you that you could help stop this spread and protect yourselves? What if I also told you that it may not cost you anything and not take any additional time? Would you do it? All it takes is adding a simple test to your annual physical. Today I'm going to tell you about the disease, a few of the different forms it comes in, as well as how you can reduce your risk of developing active tuberculosis. Tuberculosis, or TB, is an infectious disease that affects millions of people every year. It is a bacterial infection caused by Mycobacterium tuberculosis. Pulmonary tuberculosis is the most common form of the disease, affecting only the lungs. When the disease has spread to other organs, it is considered extrapulmonary. When infected with active TB, your body responds with inflammation at the sites of infection, causing severe damage which can lead to death. Tuberculosis is spread through the air. When the person with active tuberculosis coughs, sneezes, or even speaks, the bacteria enters the air. You only need to inhale a few of these bacteria to become infected. Think about how easily the common cold spreads in your office, or your school, or your home. That is how easily you could become infected with tuberculosis. Symptoms of pulmonary tuberculosis disease are similar to those of many common respiratory illnesses, such as the flu or a cold. Symptoms are typically mild for the first months, and in about 25% of cases, there may be no symptoms at all, according to the CDC. People who have active TB and are unaware of it, on average, infect 15 people or more in a single year. Based on the initially mild to non-existent symptoms, there is a huge delay in seeking treatment. This explains the widespread rates of the disease. As the disease progresses, your symptoms become more severe. You may begin to cough up blood. Further, the infection could erode your pulmonary artery, causing massive bleeding. TB comes in multiple forms, including both active and latent. Active TB disease occurs when the bacteria are spreading, multiplying, and attacking the body. In this form, you are contagious and will gradually begin to show symptoms. Without proper treatment, 2 out of 3 people with the disease will die, according to the U.S. Health News. Latent TB infection occurs when your body is infected with the live bacteria, but it has not yet begun to spread or rapidly multiply. This form can develop into the active disease without treatment once your immune system can no longer fight off the bacteria. In this stage, you will show no symptoms, and it can remain in your body undetected for years. According to the World Health Organization, approximately 1/3 of the world's population is infected with latent TB. That means 1 out of 3 people in this room could be infected. That could be you. We all need to protect ourselves and our loved ones from contracting this highly contagious, deadly disease before it becomes active. Testing and treatment for the disease is easy and effective. Testing consists of a quick and simple blood or skin test. TB must be detected as soon as possible to prevent the bacteria from becoming active if latent and to increase the success rates of treatment. In order to catch the disease early on, TB testing should be conducted during your annual physical. The test could easily be performed on the blood that you are already having drawn for your other yearly lab work. It is covered by most insurance plans, meaning it may be at no cost to you. And for those without insurance, Minute Clinics offer the testing for just $39. If this testing is implemented, TB infections can be reduced and possibly even eliminated. Now I want you all to imagine 1.4 million people. They are happy, healthy, and full of life. That is the number of lives that we could save this year. The CDC's goal is to control, then eliminate tuberculosis, the same way that they did with polio. It is possible with our help, and it starts by protecting ourselves. By including TB testing in your annual physical, you can catch the disease before it becomes active, preventing the spread to others, as well as decreasing your risk of fatality. The severity of the disease is clear. It is not only deadly, but also extremely contagious. Fortunately, if caught early on, it can almost always be cured. You can help protect yourself and your family by adding TB testing to your annual physicals. The next time you see your doctor, ask about having tuberculosis testing done regularly. It may be the test that saves your life.